You know, my life used to be very different than what it is now. There was a time where I didn't have a schedule. For so many years, I didn't appreciate what was presented to me. And today, I have a job that I make a difference in people's lives and have a purpose in life, not just living day to day. People depend on me, as strange as that may seem. Good morning. My name is Reggie, and I like to take the time to kind of relax and unwind before my day starts. But, as I reflect back and I think about all the years I've been fighting this thing, struggling, battling, trying to manage my behavior, trying to get more honest on a daily basis. I remember the waking up every morning, having no say-so whatsoever. My whole life was about use. I used to live and lived to use. As I look back, it's amazing that I've survived.
Hey, Horace, how you doing?
I've been good. I started assistant coaching for a Little League team.
Oh, wonderful.
Yeah. I used to play when I was a kid, and so it's really cool to help out.
Is your son going to be on the team?
Yeah, I think so.
Okay, then you can start building that relationship with him. As a counselor, I help them come to their own decisions on how they can change whatever is going on into a positive way that will have a positive impact on their life, and help them with whatever is going on in their lives that they find difficult. I help them work towards mending relationships that they've broken through their addiction.
Opiate drugs include heroin, codeine, Vicodin, morphine, and many others. They relieve pain and they affect a pleasure receptor in the brain.
Excuse me, what's your name?
My name's Horace.
Nice to meet you.
Nice to meet you.
How long have you been in the program?
I've been in this program for about 14 months.
What brought you in?
Heroin.
Number 21.
Hey,
Hi, morning.
Morning.
Good morning, Horace. How you doing?
Good, you?
I'm fine.
I remember how it all started, just to join amongst friends,
Thanks.
a six-pack here and there,
See you tomorrow.
Then as I continued to use, what started off as a luxury became a necessity. Even when it started to create some problems in my life, I continued to use. I had no idea that it would take me on a 20-year journey. I had no idea.
I've been around alcohol all my life, both my parents being alcoholics and all their friends. It was a big party every weekend, so it was normal to me. But when I first started noticing a difference in my behavior versus my brother's was when I was like 11 or 12 years old. We'd bring, the adults would have us go get beer for them. Well, I'd go drink half a beer and then get another one out of the refrigerator and bring it to whatever adult it was.
I remember one time, pawning a VCR, on the TV. I'll get it back next week. And I really believe that. If you would have hooked me up to a lie detector test, I would have passed.
Whenever something went wrong, I would just get high or I'd get drunk. And I'd get in trouble, and I'd go to juvenile hall. I'd do all of those things.
I remember, the stealing, the lies, and manipulation. No friends. All I had was customers and victims. That's all I had. The first time I went to jail, I said, I am not gonna ever do anything to cause me to go to jail again. And within 6 hours after being released, guess what? I used again. Maybe that's part of the compulsiveness, the tendency, the overwhelming urge to engage in some behavior. I had no idea that my life was unmanageable. I didn't know. I just thought it was bad luck.
I've finally decided to look at things differently. It's not everybody else's fault. Whereas just 4 years ago, it was everybody else's fault, and it was.
No one had told me about this. You know, it wasn't until I experienced some problems and someone sat down with me and said, hey, you might want to take a look at this. You know, you may be, you know, you may have an addiction, you know, and I was no addict. You know, I had seen these guys skinny and, you know, homeless and stinky and dirty, and I wasn't one of those guys. I was just a guy that was having some problems. You know, when you think about addiction, that's what comes to people's mind in terms of an addict.
Addiction is a physical and a psychological dependence, as simple as that. People can be addicted to opiate drugs, people can be addicted to cigarettes or coffee, some people are even addicted to behaviors such as gambling or shopping. Opiate addiction is a chronic disease which in some cases can prove to be fatal. Entering into a methadone maintenance program eliminates the physical need for opiates, and this allows the patient to live without the drug and its attendant risks. Then the patient has the opportunity to participate in work, with their family, and in society.
It took me a while to go to the clinic. I thought maybe I thought I could do it myself, you know? And I thought the guy responsible for doing the heroin could also be the guy responsible for quitting, you know? It's just a crazy thought. You know, it comes down to a real simple thing, you know? When you're doing heroin, there's only like 3 choices. It's either jail, death, or institution. I'm not going there, man. I'm doing something different. This is my apartment. This program's really helped me out a lot because it's helped me balance out things and be more responsible. And I've heard that sound many times and gotten really scared. Now I don't feel quite as scared. It's only been in the last year and a half that it's looked like this. I'm comfortable. I can bring my kids over here and we can watch movies and stuff. And before, my ex-wife wouldn't even let me be around the kids at all before. And now we have a much better relationship, and so I can actually be with them. You know, she had a restraining order out on me for a while because I could get pretty scary. This program has just really helped me out. You know, I know it's weird because it's like I feel like I'm on this edge, you know, and it's like if I look that way, I can see my old life, and I'm like, I could fall into it, you know, but there's this other life that I've never had before, and I can see that over here, and I want to stay leaning this way, you know, and I know what's there. I don't want to go back there. I'm trying to stay focused on this.
Opiates stimulate a pleasure receptor in the brain. Over time, the body comes to expect and rely on the presence of the drug. Most opiates last only a few hours, thus forcing users to seek frequent, repeated doses. Methadone calms the pleasure receptor without causing a high. It stays in the body for 36 hours, thus eliminating the roller coaster of experiencing withdrawal and seeking illicit substances. Research shows that methadone does not affect daily activities such as driving, thinking, or reasoning. It does not affect coordination or motor skills. Methadone does balance the physiological chemistry, allowing patients to function normally in home and work environments.
First things first, you've got to make a decision to seek help. Once you've made that decision, visit your nearest clinic and bring some ID with you, like a driver's license or insurance if you have any. Once you've made the decision to seek help, we will help you every step of the way.
And so as my life got better, I started to better understand this process. I made a decision to become a counselor, a chemical dependency counselor. This is a horrible disease, and I wanted people to understand what they were getting to. If I could give a warning, you know, if I can help a person better understand the path that lies ahead, that what seems like joy is really hidden destruction. My job today is about motivating change. It's about inspiring, it's about educating, and it's about generating some hope on a daily basis.
After making the important decision of coming to our clinic, there will be a counselor there to meet with you and help you through your journey. The counselor will ask you medical history and drug use questions. Whatever you say to the counselor will be confidential and private. Ask questions. This is the time for you and your counselor to get to know each other.
We'll meet in the second stage of the program. After reviewing your vital signs, we will discuss your health history and I will perform a complete physical exam. Then, I determine the initial methadone dosage and answer any questions you might have. Throughout your time in the program, another doctor or I will monitor your progress and change your dosage if necessary. You will also have the option to take a tuberculosis as well as an HIV test. We encourage healthy and responsible behavior and enjoy seeing our patients getting better.
Initially, patients will need to attend the clinic every day. We will try to accommodate patients who show progress on the program and have work or school schedules that conflict with clinic hours.
New clients need to understand is that it's their choice, but they have to make the choice to get sober and to want to stay sober. That every day they need to make that choice. And no matter how hard it is, they have to just not use right then, because the feeling goes away, the urge goes away within 5 minutes usually, unless you keep thinking about it. So to teach them to replace it with something else, which is anything, animals, call somebody, it's actually a lot easier to be sober than it is to stay high all the time. It really is.
It's frightening to face problems alone.
But you don't have to do it alone.
We offer you a choice and a chance for a better life and a brighter future.
And this is the goal of our clinic.